Hi, let's talk about occupational health today. A very new term for many of us, I guess. We are familiar with words like occupational therapy, but that is completely different. Here we're talking about occupational health that focuses on the interface between health and work. We probably heard in India about, work-related injuries like musculoskeletal injuries, poisoning, factories, related issues, asbestosis, COPD, and things like that. But that's very different. That is more to do with the labor and the kind of work they do in factories and all. But I'm now wanting to focus about occupational health for our IT colleagues and people working in corporates. How does it work there? In Western countries, they have occupational health physicians who deal with all this. They would do a proper assessment for a person, understand the impact of work-related issues on them, and give them a summary or formulation, which can be then followed at workplace. But in India, we do not have such a well-structured framework. So how can a psychiatrist get involved here? Well, in many companies, I think the HRs, the human resources, manage the employment wellness programs, mental well-being, and so on. But as a psychiatrist who's probably, who's specially been trained in the UK, I have an understanding of how it works here. So what I can do for you all is I can do an assessment, understand the impact of your work, whether it is stress, anxiety, depression, interpersonal dynamics, how the work culture is influencing you, or so on. And we can sit down and try to have a good formulation as to, is it the working hours that are affecting you, is it actually not work but home and personal issues affecting you. So there's a lot that can be looked into, and we can formulate and put in some suggestions for your company or your workplace to help you with. It could be adjustments that can be done at workplace. It could be about giving you flexible timing. It could be about giving you work from home for a particular time. So whether you're going through stress, depression, anxiety, or bigger illnesses like bipolar disorder, schizophrenia, and so on, please do consult us. There is always a way out. We can help you with some accommodation and adjustments that can be advised. I know there is a lot of stigma attached to mental health issues in India, but things are changing, and a lot of companies are coming out with a lot of support from their HR and seniors to help you out. So why not try it? So think about it and do book a consultation with us, and we're here to help you.